Good morning, Tammy. Are you ready to do your med pass on Miss Blackmore?
I am, Miss Palmer.
Okay, go ahead and get your medications. I'll be right here.
Okay, thanks. All right, so there are some key things we need to look at when we pull our meds. So these are the things that you need to be saying to yourself with every med, every pull, okay? So I'm going to double check to make sure that I have the correct patient, which I do, and she did tell me her name and date of birth in there. Remember, I had my MAR in my room when I went to introduce myself, so I know that I have the correct patient, and they have the right birth date, which means I have the right MAR. Okay. So now I'm ready to look at my 8 a.m. meds. This is my 8 a.m. med pass. So I'm looking at my 8 a.m. meds to see what I'm going to need to pull. So my very first med, and I'm going to go in order on my meds sheet so I don't miss anything. So my first 8 a.m. med that's scheduled is Practiprilo or Prilosec, 20 milligrams PO every a.m. before breakfast. So I'm running through TRAMP, right? I'm making sure I have the right time. I'm making sure I have the right route, the right amount, the right medication, and the right patient. And of course, when we're done administering the medications, we're going to document them. So remember, if it wasn't documented, it wasn't done. You know, I say that all the time to you guys. All right. So my medication, I need Practiprilo 20 milligrams. And I did check with my patient, and they did say that they're able to swallow their pills just fine with water. So I'm going to pull out my patient's med drawer. I'm going to put it right here. And I'm going to look for Practiprilo 20 milligrams. Okay, so here it says Practiprilo 20 milligrams. Okay, and again, you guys will get to practice this in lab, so you'll see this a lot better. So I'm not going to open any of my medications yet. I'm just pulling them right now. Okay, I'm going to hold it up to my MAR and I'm going to check it one more time. Practiprilo 20 milligrams. PO, this should be a pill. We're good. So that one's done. What I like to do is take my pen and I put a real tiny little dot under the 8 a.m. slot. So it reminds me that I had already pulled that medication. It just kind of keeps me on track. Then the next thing that I need is heparin, 5,000 units, sub-Q daily in the AM, scheduled for 8 o'clock, so I'm going to need to find my heparin. Okay, heparin sodium injection, 5,000 units per ml. So I know one of the things my instructor is going to ask me is how many mLs I'm going to have to pull up on this. So if it's 5,000 units per ml, my order reads 5,000 units. I'm going to need to drop 1 ml. And again, I'm not going to draw this up until my second check, so I'm just pulling my meds right now. So I have my heparin, 5,000 units. My next med is Practilasix or Lasix, 40 milligrams PO daily in the AM. So I'm looking for that. And that's it. Practilasix, 40 milligrams. Practilasix, 40 milligrams. My next med is my docusate sodium or Colace, 100 milligrams PO once daily. Now this one I know because I've done a med pass before, but you might not know this on your first one, that this is going to be in one of those big stock bottles. So I'm going to go to my stock drawer, and I'm going to look for my docusate sodium. So docusate sodium, 100 milligrams. Again, I'm just pulling the meds right now. I'm not going to dump them out and put them in the cup yet. I'm going to do that with my second check, okay? But I want to take it out of the box and ensure that the bottle says the same thing as well. Stool softener, docusate sodium, 100 milligrams. And this is 100 milligrams per capsule, so I'm going to need 1 capsule when I'm ready to pull that. Okay. Next, I have pilocarpine hydrochloride, 0.5%, 1 drop in the left eye TID. Remember, TID means 3 times a day. So it is scheduled for 8 o'clock this morning, so I'm going to find that. Okay, pilocarpine hydrochloride, 0.5%, so I have the correct solution. And lastly, I had asked my patient, she has a PRN for cough, and she said she was coughing a little bit this morning and she'd like something for that. So she does, or she can receive at 8 o'clock right now, dextromethorphan guaifenesin, which is Robitussin, basically. She can have 5 milliliters PO every 6 hours, PRN for a cough. And she did request that. And that, again, I know is in a stock bottle, because I've given that before. So I'm going to find my bottle. And it says, now, one thing to note on some of these stock bottles is the label, the big wording on the label might not always say exactly what's on the MAR. So this MAR says dextromethorphan, methorphan, good luck with that, guaifenesin, and it says on the bottle, Tussin DM. So I may need to turn the bottle and look at those active ingredients to find that generic name. So if I turn the bottle and I look here, it does say, however you say that, guaifenesin on there with the correct dosage of 10 milligrams for the however you say that, and guaifenesin 100 milligrams. Okay, so I know I'm going to need that. And I'm going to mark that as well. All right, that's all I needed on my MAR. That would be considered my first check. So pulling your medications and doing tramp with all of those is your number one check. The second check I'm going to do with my instructor outside of the patient's room. And then the third check will be when I actually go to administer it to the patient. So we're going to go into a live scenario mode right now so you can see the second and third check being completed.
Okay, Tammy, I see that you've gotten your first check done, and it seems like you've gotten everything out that you need to have. How did you know that those medications like Colace and Tussin were in the bottom drawer there?
Well, I couldn't find them in my patient's drawer or their patient's tray, so I knew that it had to be somewhere because it's ordered. So I figured the next step would be to check my stock meds.
Great.
And there it was.
Great. Sometimes if you think of an over-the-counter medication like aspirin, Tylenol, Colace, those are going to be your stock medications. So I'm glad you critically thought through that and picked that up. Great job.
Thank you.
All right. So let's go over to outside the patient's room. Let's talk about the medications you have here.
Okay.
Okay. Okay. So we're right outside of your patient's room here, and I'm glad that you've already talked with her and you already know that she wanted some cough medicine because she's got a little bit of a cough, so that's great. So let's talk through a little bit about your medication that you're going to be giving here. So tell me about your first medication.
Okay. Well, I remember you saying in pre-conference that before we give our medications, we always have to look up 3 things about them so that I can be prepared and I always know what I'm administering to my patient.
Great.
So I remember you said, of course, we have to know the name of the medication, and you wanted to know the generic name and the brand name.
Yes.
You wanted to know the therapeutic class of the medication. You wanted to know therapeutic action of the medication, and you also wanted me to tell you side effects of the medication.
Yes.
And you said there were a ton of side effects in the book, and of course we'd probably scare a patient if we told them all those side effects.
Right.
So I used my book the way I should, and I just wrote down about 3 to 4 for each one, and they're the ones that were bolded or italicized on there. That meant they were the most important things to look for.
Yeah, the life-threatening things are the things we want you to look out for.
Okay.
So great.
So can I use my cheat sheet when you ask me
Absolutely.
these questions? Okay, great.
So why don't you tell me the 6 rights to the first medication?
All right. So the first medication we have on our list is Practiprilo. And our 6 rights, again, Miss Blackmore told us that we could learn it by saying tramp.
Okay.
So T stands for time. And I know I'm giving the 8 o'clock I'm doing the 8 o'clock med pass, and this is due at 8 a.m., so I know I have the correct time.
Okay.
The second piece of that is R, and that's root. And I'm looking here, and it says that it can be given PO.
Okay.
And I did check with my patient ahead of time to make sure that she was okay to swallow these pills.
Great.
And she said she was. So that's an effective root for her.
Okay.
And then my A is amount. So I'm checking my dose of my medication.
Mm-hmm.
And it says here that it's 20 milligrams. And when I go to check my pill,
Great.
so I have my Practi-Prilo, and it says on here that it's 20 milligrams.
Great. So always have the medication right out next to there so I can see that you're going through that.
How's that?
Great.
All right. So then the next thing, of course, is the M is the next is medication.
Good.
And I know that it says Practi-Prilo or Prilosec, and it says Practi-Prilo right here.
Okay.
So I know I have the right med. And then lastly, P is patient.
Okay.
And that I double checked a couple of times. I checked it when I went into the room with my patient, checking their name band. And I also checked the MAR to the name band. And then when I was over at the med station, I made sure that I was doing the meds on the correct person there as well.
Yes, and we'll have more of a verification when we actually go in there and do our third check. Okay. So we'll do another check of the name band.
Okay.
Great.
So shall I continue on?
Yes, I'm satisfied with your 6 rights there. What's so you told me 5 of the rights. What's the last?
Documentation.
Right. So we've got the right documentation.
Miss Levante stressed that in documentation class.
Yes.
Wasn't documented, it wasn't done.
Yes, that's right. Okay, so can you tell me anything about the med? Let's just one thing about the med. Tell me adverse reactions.
Okay. I can use my cheat sheet, right?
Absolutely.
Okay. Well, adverse reactions for this medication says abdominal pain, nausea, vomiting, dizziness, and drowsiness.
Okay.
So those would be things that I look for on the patient after I give the medication. Is that correct?
Absolutely.
Okay. So that should kind of raise a red flag to see maybe they're having a reaction to that med?
Yes.
Okay. All right. So then I'm done with my Practi-Prilo.
Great. So we can go ahead and put that in the cup.
Okay.
Saying that we're ready to, we don't have to actually open it, right? We don't want to open it until we do our third check in front of the patient, but we can put it in the cup so it's ready to go. And now we can move on to the rest of our meds here.
Okay. My next one is heparin, 5,000 units, sub-Q daily in the AM.
Okay.
So, I go through TRAMP again, and again, I know I have the right patient. So I'm going to look for my heparin, and I know that it is sub-Q. It's a shot, so it's going to be in a vial because I'm going to have to draw something up.
Great.
And I just noticed that I forgot to get my syringe that I need. So rule number 1 in MedPass is never leave your meds unattended.
Right.
So even I forgot something, I either A, need to take them all with me, or since you are a RN.
Well, I think what will help you remember not to forget your syringes is if you have to take them all back with you. Okay. So I'll let you take that back.
Okay, I'll be right back.
Okay.
Yep, that was it.
Yeah.
It really is perfect. Okay, I'm back.
Okay.
All right.
Great. So Tammy, just talking about drawing up this medication, what made you choose this syringe as opposed to a different syringe?
Well, I have a wonderful instructor who teaches us pharmacology, and we just went over, how to administer medications and how to, what syringes we need for what. So when we're giving a sub-Q shot, we want to be in the subcutaneous tissue only. So I know I'm going to need a shorter needle for sure and a smaller needle for sure. But I was taught very well, and they said that for a sub-Q shot, it's going to be a 1 milliliter syringe because we're not going to give more than 1 ml when we do that. And 27 gauge is the size of the needle, and the bigger the number, the smaller the needle is. And 1/2 is the length of the needle. And I know I don't want to go over 1/2 because if I do, then I'm not going to be in the subcutaneous tissue any longer. So this seemed to be the appropriate syringe to choose.
You have an excellent instructor. I think that is exactly what I wanted to hear.
Okay.
Great job.
All right. So now that I got my supplies, I can continue with this medication.
Yes.
So my order says 5,000 units. of heparin.
Mhm.
And I know on my label of my heparin here, it says 5,000 units per ml.
Okay.
So that means, according to my ordered dose, I need 5,000 units. So I'm going to drop 1 ml of this medication.
Great.
And again, I had a great instructor. So I'm going to wipe off the top of my vial. For minimally 15 seconds.
Great.
I'm going to let it air dry for a minute. I'm going to prepare my syringe. Okay. I know I need 1 ml, so I'm going to draw back 1 ml on my plunger. Carefully not touching this part of the plunger because it does go back into the syringe and can contaminate my medication. Carefully uncap. Place my syringe in my vial. Push my air into my vial. And then carefully draw back 1 ml.
Now, just so you know, Tammy, those are very dainty needles, so you have to be very careful not to bend them in any one direction. It will bend the needle very easily. So keep that vial nice and straight.
And ensure that there's no air in there, because if I get air in my syringe, that will alter the dose that I have.
Okay.
So I need to make
Great.
sure I have the correct dose.
Mm-hmm.
Okay. And I'm going to keep my vial on there so you know that I did draw it up out of that vial and that it is in fact heparin.
Yes.
And it is at 1 ml.
Okay.
Okay.
Why would you want somebody to double check that?
Because this could be a pretty fatal medication. If we give somebody too much of this medication, it is a blood thinner. It's an anticoagulant.
Yes.
So if you give too much of it, somebody could really bleed from it and
Those
cause
are
a serious side effect.
Absolutely. Those are one of our medications that we definitely want to make sure we double check.
Okay.
Great.
Now I have a question.
Mm-hmm.
All right. So I'm not in the patient's room yet. Is it appropriate to leave my syringe like this in the vial?
No, you cannot do that. But remember, you have to safely recap.
Okay.
So show me how you would safely recap.
Well, the great thing about, can you see that?
Sort of.
About this kind of cap, and I'll pick it up here. It has a flat end on it.
Mm-hmm.
Okay.
Mm-hmm.
So it allows me to set the cap down safely like that.
Mm-hmm.
And then I can very safely, without using my other hand, place the needle or the syringe right into the cap and lock it in place. So I don't need a second hand to hold the cap.
Yeah.
So that is the safest way, I believe.
Yeah, that's actually a
recap.
really good technique, because if you scoop, sometimes you can not put the cap on all the way, and then you end up causing problems with the needle again. So that's a great technique.
Okay.
Mm-hmm.
All right. So I have my heparin ready.
Okay.
My next one is my Lasix, or Lasix, 40 milligrams PO.
Okay, so I want you to take me through the 6 rates of that medication.
Okay, so again, it's tramp,
Mm-hmm.
so I have to ensure that I have the right time.
Mm-hmm.
This is the 8 a.m. Med Pass, so it does say 8 a.m. on the MAR. The next one is Root,
Mm-hmm.
and it says PO here. And again, I had asked my patient if they could take their meds PO, and they can. The next one is the correct amount. It should be 40 milligrams, and it says on the packaging here 40 milligrams.
Great.
And then the correct medication, we need Lasix. It does say Lasix,
Great.
so I know I have the right med.
Good.
And then, of course, the correct patient, and when we administer, I will document.
Great. So can you tell me, is that a potassium sparing or a potassium saving medication?
This is a...
Or potassium excreting, I'm sorry. What a terrible instructor.
It excretes potassium.
Yeah.
This
So
is not a sparing
what would
one.
be a lab that maybe you want to check before you get into your patient's room then?
I would think that would be potassium.
Yeah, yeah.
Okay.
Just in case.
Okay.
Great. So that's all you have to tell me about Lasix.
Okay. So I'm going to put that in my cup because
Great.
that one's done. My next one is Docusate Sodium, or Colase, 100 milligrams PO once daily.
Okay.
And I remember this is the one that was the stock med.
Mm-hmm.
As you so nicely reminded me, this is something that a lot of our residents get. So it's much cheaper for them to pay for it in a big stock bottle versus individual. So this does say on here, docusate sodium 100 milligrams, 100 milligrams. So I'm going to double check one more time because this is different. Docusate sodium 100 milligrams, 100 milligrams. So I'm going to pull one tablet out of here. And the best way to do that, I don't want to touch it. So I have to open up my bottle. Okay. So I'm going to try and put one tablet into the cap. One tablet. Like so.
Great.
All right. And then I'm going to just dump it into my med cup with my other medications.
Now you're going to continue to bring that bottle in the room for your third check, right, Tammy?
Yes.
Great.
Because I need to ensure that if the patient ends up refusing that for some reason, I can identify that pill correctly.
Good.
Now, would it be better practice if I had had that pill in a separate med cup and placed it in front of there?
Sure.
Okay.
Because then it would be easier to find.
So this would have been better.
Yes.
Okay. I'll remember that next time. I'm really bad with my supplies today.
Yeah, that's all right.
Okay.
You're doing great.
All right. I'm a little nervous.
Tell me what the drug class is for Colace.
For Colace, it's called a laxative.
Okay.
And it softens the stool.
Great. That's what I was looking for.
Okay.
Some people think that'll make them go, but really it's just to help with water reabsorption.
So it won't make them be explosive.
No. It'll just help soften the stool. So that if your patient says they don't want to take it because they have loose stools, maybe you just need to educate them that it's just going to help soften their stool, not make them have diarrhea.
Okay. My next med is pilocarpine hydrochloride, 0.5%, 1 drop in the left eye, TID.
Okay.
So I'm looking for a liquid here.
Okay.
All right, and I remember what she showed us in class. This looks like an eye drop bottle.
Okay.
So let me see. Pilocarpine hydrochloride, 0.5%, and it says ophthalmic solution, and ophthalmic means eye.
Great.
So I know I have the correct solution.
Okay.
Again, I run through my tramp really quick. Do you want me to say that out loud again?
No.
Okay.
I see that you're working it out.
Okay. So I do have the eye drop. So I'm just going to check that I have that done. There's nothing I can do with this right now until I'm ready to administer it to the patient. So I'm just going to put that there.
So there's two key things I want you to remember when you're administering this to the patient. Remember to keep the patient's anatomical position in mind so you don't accidentally put it in your left eye, your left side as opposed to her left side. Okay. So remember anatomical position. And what did Miss Blackmore tell you about the tip of it?
Never touch it to their eye.
Great. So you're really going to have them lift their head back and open up that eye so you can get that drop right in there.
Now, could I ask a question?
Sure.
What if they say they want to give their eye drop themselves? Is that appropriate to do?
Yes.
Because they do it all the time at home?
Absolutely. As long as they're cognitively able and they're physically capable, that's fine.
Okay, great.
Yes.
Because I know, Mark said he had a patient last week that could do that, and he was a little nervous. He wasn't sure if that was okay.
Okay.
But they did it appropriately.
Sure. Especially in long-term care, it's their home, so that would be fine.
Okay.
Great.
All right. And then lastly, I have the cough medicine. That one that's really hard for me to say.
Okay.
That dextromethorphan, 10 milligrams, and guafenicin, 100 milligrams.
So you know that it's really hard for you to say that name. Which part of the name is that? The trade name or generic name?
That's the generic name.
So then you want to use the trade name when you're talking to the patient, and that will not only make you look like a credible nurse, but it will be easier for you to say as well.
And
so.
it's more commonly known by that trade name. So they
Yes.
probably will know what I'm talking about better. I get it. Because I didn't understand what this was until I saw the trade name.
Yes.
All right. So I need 5 milliliters PO every 6 hours, PRN for cough.
Okay.
So I need to look at my label.
Mm-hmm.
And again, this says Tussin DM, so I had to turn it to look at the active ingredients to get the generic name, and it is appropriate. It says, that dextromethorphan, 10 milligrams, and guafenicin, 100 milligrams.
Okay.
So I'm going to pour 5 mLs of this. So I need one of my med cups that has my measurements on it. And again, my instructor, my teacher, was wonderful and said, rule number 1 when you're pouring liquids is always to get down at eye level. So I can look at the meniscus of the liquid to ensure that I'm giving the correct dose. So I'm just going to look for 5 mLs on here. And is this correct, Miss Palmer? It's right there.
Yes.
Okay.
Remember, not ounces, milliliters. So that's great.
And I'll take care to read the label on this medication to see if I need to shake it before I administer it or not. And this one says you do not need to, so I can go ahead and safely pour.
Great. Okay. I'm just going to double check that to make sure you're right where you need to be here. Well, that is perfect, Tammy.
I'm having a good
Great
day.
job.
Thanks. I have great
Great.
instructors.
So I want you to tell me something. Since you poured a milliliter, can you tell me how many milligrams is in that dose?
In my medication that I just gave?
Yeah, of each of the meds.
Of each of the meds. Well, it says here on my label that the dextromethorphan has 10 milligrams per 5 mLs right here.
Great. Good.
And that the guafenicin has 100 milligrams per 5 ml.
Great. So if I asked you to drop 10 mLs, then you would have to do a little bit of math to understand how many milligrams. But you've read your label and you know exactly how many milligrams you're going to be giving.
Okay.
Great job.
All right. That was my last medication.
Okay.
So that is the end of my second check.
Great. So I think we can go in and talk to the patient. I just want to give you a couple hints before you go in. Be careful telling the patient any kind of medical jargon. So try not to say things, again, use the trade name. Try not to say things like it could cause anaphylaxis. You know, you're certainly going to give them some of the common side effects and the name of the medication, but you don't need to tell them some of the other stuff that I would ask you.
Okay.
So, you know, they need to know what the medication's for in simple terms. You don't want to say an anticoagulant. You might want to say something like it's thinning the blood for ...
Okay.
So, you know, make sure they understand why they're taking the medication.
Okay.
Okay?
And that's something I'll go over with you every time as well, right?
Yes.
So I say the right thing to the patient.
Yes.
Okay.
And if you have any, if you haven't passed any of these medications, we certainly could talk about them. But I know that you've given Miss Blackmore her meds before, and I've watched you do it. So I just wanted to remind you of those little hints.
Okay.
Okay?
I'm ready.
Okay. Let's head on in.
Good morning, Miss Blackmore. I'm back. I have your medications. Are you still having that nasty? You're still having that nasty cough. All right. Well, I'm glad I brought you your cough medicine then. You got enough water in there? Okay. Can you sit up a little bit more there? All right. I just want to do one more check. This is my instructor, Miss Palmer. I don't know if you met her.
Good morning, Miss Blackmore.
She's
How are
really
you
good about
feeling today?
Not bad, except for the cough.
Oh,
Can I just take your name and date of birth one more time, please? Can you tell me your name?
816 on Bruce Blackmore.
That was correct. Okay. So I have the correct name and I have the correct date of birth. And can you tell me, do you have any allergies?
Sulfa.
Just sulfa. Okay, good. I'm not giving any sulfa meds today, so we are good to go.
Okay.
All right. Are you ready for your medication?
Yes.
Okay. So the first medication I have for you today, and I have one more question for you before I get started. Are you able to take all your pills at once?
I can swallow them.
Okay, so I'll prepare them all at once for you, and then you can take them. Okay. And now I do have a little shot for you today. You've been getting it. It's your blood thinner. We'll talk more about that when it comes time.
Okay.
You want me
I
to-
don't like needles.
Okay. Well, my instructor, she'll distract you, so
Okay.
you won't even feel it.
Okay.
Okay?
I might pass out.
Oh, Lordy. Okay.
you remember last week when Tammy gave you that shot? You said you never felt it one
That's
bit.
true.
Yeah.
That's true.
Yeah, she's got a really good technique down.
She's a good nurse.
Yeah, she is.
What good instructors. Okay, so what I'm going to do again is I'm going to double check all my medications once again. So I
Okay.
just pulled everything out so I can make sure I have the correct med.
Okay.
So the first one I have for you is your Prilosec. Okay.
And what's that for?
And that is to help with your ulcer that you have in your stomach.
Oh, okay.
Okay, so hopefully that'll start feeling a little bit better over time.
Okay.
Yes. So Prilosec 20 milligrams. Prilosec 20 milligrams. All right, so I'm just going to open them up and put them in the cup.
Okay.
Okay, so this is your Prilosec.
Just remember, Tammy, not to touch the medication. If it gets stuck, we'll use some gloves to get it out.
Okay. All right, and then I have your heparin, your 5,000 units of heparin. That's your heparin shot.
How come I have to have that?
That's a blood thinner. And do you remember when you had a heart attack a couple of years ago?
Yes.
And the heart attack caused you to have the abnormal heart rhythm called atrial fibrillation.
Yes.
And that can cause some blood
Clots in my
Okay,
yes.
see, you got it. You got it. So this just helps with that.
Okay.
Okay. And you want me to save that for last?
Sure.
Okay, I'll do that. So I'm gonna skip over that then. Then I have your Lasix. Let's see here. Lasix.
Oh, that's your favorite pill,
40
Miss
milligrams.
Makes me
Blackmore.
pee.
Yes.
That's
I
your
get up
water
all
pill.
the time and go to the bathroom.
But you know, with your high blood pressure and your heart failure that you have, you know, it really helps ease the workload of your heart so your heart doesn't have to pump so hard.
All right.
Okay, so it's really important. But I'll make sure that you get it in the morning and not in the evening.
So I don't have to get up all night.
Yes, ma'am.
Yeah,
Okay.
it's helped the swelling in your legs
Yes,
already.
now they're better.
Yeah.
All right, Lasix 40 milligrams, Lasix 40 milligrams. Put that one in the cup. All right, docusate sodium, Colace. All right, Colace. This is your stool softener.
All right.
Okay. Are you experiencing any like really loose, runny stools?
No, I think I need to take it.
Okay. Are you feeling a little constipated?
A little bit.
All right. Well, hopefully
I think
this
I'm
will
sitting
help.
around too much.
Well, we'll get you up and walking. Because you know what? I see on your board that it says to ambulate you 100 feet every day. That's our goal.
Okay.
So how about when we're done with MedPass, we take a little walk?
All right.
How's that sound? And I have to put my name on that board so you remember me. All right, so stool softener, docusate sodium, 100 milligrams. 100 milligrams. Right? And that's that funky striped pill.
Okay.
Okay? All right. Now that's it for your pills. Do you want to take those right now?
Sure.
Okay. Here's your water. Okay. Now Miss Palmer, she took her pills, so I'm okay to sign them off right now, correct?
Yes, you don't ever want to sign them off until she's actually swallowed them, because then there might run a risk that she might not take them.
Okay.
So
Did
that-
they go down okay?
They went down fine.
All right.
I don't feel like I'm gonna vomit.
Okay, that's good. Well, you ate a good breakfast this morning, so probably helpful you got something in your stomach too before you take them. All right. So the next thing I have here is your pilocarpine hydrochloride. That's your eye drop that you get for your glaucoma treatments.
Okay.
Okay. So what I'm going to do is administer that. Do you give yourself your eye drops at home?
I usually do.
Usually do. Do you want to do it this morning,
Yeah,
or
I
do you
can
want
do
me to do
that.
it? Okay. And this has to go 1 drop in the left eye. Okay. Which
Okay.
one's your left?
My OS.
Okay. So you want to do this morning,
Sure.
or would you like me to?
Here, Miss Blackmore, here's a tissue.
Thank you.
There you are.
Remember,
gonna
Miss
pull-
Blackmore, not to touch the eye with
And
that
I'm
tip.
gonna pull the lid down and
Yes.
put it right in the conjunctiva.
Oh, that's
You
a
did
pretty.
that great.
That's a pretty long word there. Great job, Miss Blackmore. I'll take that with my gloves and throw.
All right. I just signed that off. She did that. Oh, then we got your cough syrup here. Okay. Oh, here we go again. Dextromethorphan, guaifenesin. We know it as Robitussin.
Robitussin,
Okay. 100 milligrams, 10 milligrams, 10 milligrams, 100 milligrams, 5 mLs. I'm just going to double check that real quick. Make sure we didn't dump any. Okay.
Great job on your 5 rights there, Tammy.
Okay.
Lid tastes awful.
I'm sorry. Here, have a sip of water. All right. All right, I've signed that one off. Okay. You ready for your blood thinner?
All right.
It's, remember, it goes in your belly because it gets absorbed the best in your belly. That heparin likes to go in your belly. Okay.
Oh, here, Tammy, here's a little hand
Oh, thanks. I
sanitizer.
was looking for that.
Yeah. Just had to get you some.
A wet one.
So you going to bingo today, Miss Blackmore?
Bingo, yes.
Oh,
You better
good.
get me up and get me going.
That'll
Yeah,
be your walking
I heard you
day.
won some money the
I
other
won a
day.
whole 50 cents.
Wow.
Woohoo! You're rich.
That's all?
You gonna go to the gift shop?
Yep.
All right.
Gonna buy candy.
Oh.
Oh.
Well, luckily you're not diabetic, so
No.
you can have a little candy.
Now, Tammy, I just want you to remember proper technique when you're administering the sub-Q injection, okay?
Yeah. Okay. So I'm going to find the proper place to go. I'm going to make sure that we're not near any prior bruises or too close to your belly button
Okay.
because that would hurt. So we're not going to do that. So it looks like I'm going to go right here today. How does that look to you?
All right.
Pretty good?
What angle are you gonna go with?
I'm going to go at a 45-degree angle because
Okay.
it's a sub-Q shot. Okay. I'm going to wipe off the spot, a little chilly.
It is cold.
This will wash away any little germs or bacteria that are sitting there. And I'm going to let it air dry.
How long would you wait to let it air dry?
Like 5 to 10 seconds is
Great.
probably good. So
Great.
while I'm doing that, I'm going to double check to make sure I have the correct dose in here.
Okay.
So again, it says 5,000 units. 5,000 units per 1 ml. I have 1 ml in there. 1 ml.
Perfect.
That's a lot.
It looks like a lot, but it's really not that bad.
Less
You've
than-
had these before.
Yeah, less than a teaspoon.
I don't like needles.
Okay, so this is what I'm going to have you do, Miss Blackmore. How about you talk to Miss Palmer
Yeah.
for me while we do your shot? How's that
Okay.
sound?
Yeah.
And you
so
don't even see it coming, okay?
so tell me about Elizabeth, your granddaughter there.
My
How's
granddaughter.
yeah, how's she
Oh,
doing?
she's fine.
Yeah.
She's getting big.
Oh,
They
yeah.
brought her to me the other day.
Mm-hmm.
Okay, all
Did you
done.
do it?
I did
That's
it.
it.
It didn't hurt at all.
Good. So I went in at my 45-degree angle. I slowly pushed in the medication. Of course, I pinched because Miss Blackmore, your, sister who teaches at the school said that we need to really make sure we pinch good when we do the sub-Q. So I pinched, I administered, and then I safely capped my needle prior to walking away from you.
She
So
tell you to pinch an inch?
she did. She
And
did that.
never-
I always remember that.
And never recap, right?
No.
Recap a dirty needle, and we use our safety
I use
device.
my safety,
Great.
and immediately it goes into the sharps.
Great.
Okay.
I also want you to take note to what quadrant you put that in, because you're going to need to document that on your medication administration so we can rotate sites
Okay,
to the next
so-
nurse.
Left upper quadrant, we put that
Okay.
in.
Why do
You're
you want to
not-
rotate?
Because if we continue to keep putting it in the same site, you can eventually get some scar tissue in there and it won't absorb as good. I could overdose you in one spot if I'm
okay.
not careful. Plus, heparin tends to leave behind a little bruise because it is a blood thinner, and it's
Okay.
going to hurt if I keep going in the same spot. So
All right.
that's why it doesn't hurt, because I find new
Did
spots
you have to
go in.
aspirate that?
No.
No. Okay.
Nope. Okay. All right. You're not bleeding at all there, so you look good. So we're
All
just going
right.
to cover you back up. Okay.
Am I done?
You are done. You did a great job today with your medicine. Thank you so much for letting me give it to you.
Okay.
I gotta make sure I sign the signature page. I think I already signed it from before, but I'm gonna double check it when we leave the room to make sure that that's done. Can I get you anything else right now, Miss Blackmore?
No, I'm good.
All right, you got your call-down,
Yep.
your side rails are up. Well, in the
Bed-
nursing home they wouldn't be up, but the bed is down.
Bed
in
is
the
locked?
low position,
Okay.
and it's locked.
Great.
All right, I'll be back in about an hour to come and get you for your
bingo?
bingo.
Okay.
Okay, and I'm gonna write my name on the board really quick so you remember who I am.
Okay. Thank you.
All right, let me do that. Remember your nurse is Ruth, same name as you.
Oh.
And your tech is Janice. And I'm your student nurse, Tammy.
Okay.
All right, Miss Blackmore, thank you so much for letting me give you your medication today.
Thank you.
And I'll see you in about an hour.
Okay.
Have a good day. You too.
Okay, great job, Tammy. Come on out here and let's talk about that med pass.
Okay.